Are you concerned about your ears? Do you keep your hair long so that it always covers them? Well, today I'm going to show you all about the ear pinning procedure known as otoplasty, here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's so good, I won't even worry anymore. Took all my care, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking all about otoplasty, which is a procedure performed on the ears that stick out just a little bit more than necessary. Right now I'll be talking to Dr. Thompson, who has performed the ear pinning procedures that you're going to see on our patients later on in the show. But first of all, welcome Dr. Thompson, how are you?
Fine, Troy.
I want to ask you, for people who don't know, now we say ear pinning, otoplasty is the technical term.
Right.
What is it?
Otoplasty is simply a procedure where you reposition the ear, just change it from a different position. And most commonly it's an ear that just sticks out too much, and so there's a fairly simple surgery that we do to reposition the ear, and it can have a few different causes and a few different techniques.
I understand that, but how do you do the procedure?
The procedure is done through a small incision on the back of the ear. And there are permanent sutures that are placed, or stitches that are placed, to reshape the ear and move it closer to the head.
Can you have them pinned back too far?
Yes, you could have them pinned back too far, and if that happened, you could actually release them and let them back out. So
you can?
It's one of those procedures that once it's done, it's not too late. You could reverse it if
Interesting.
you needed to. Yeah.
That I did not know. I threw you a curveball because it just came into my head.
Yeah.
Talk to me about, is there an age that you should start looking at that? So 8, 6, 5, what's the age bracket you should look at?
The ears are considered to be close to their adult size by about age 7, and we typically don't like to do this surgery before then for a couple of reasons. That's one of the reasons, but also if I do a surgery on someone, I want them to be in the driver's seat. I want them to be making the decision, and so we don't do this on a 2 or 3-year-old child. Okay,
I understand. What type of anesthesia do you use, Dr. Thompson?
That all depends on the patient as well. The older the patient is, the more likely they are to be able to tolerate under a local anesthesia where they're completely awake, but we also do it under general anesthesia often as well.
Is there a lot of pain?
There's not a lot of pain. There is some discomfort for the first week or so afterward, but most patients really don't complain of a lot of pain. It's a very easy thing to recover from.
Dr. Thompson, thank you. I want to throw to a quick tip about the different forms of anesthesia and when each of them is actually used. Anesthesia is broken into 3 main categories: local, regional and general, all of which affect the nervous system. Local anesthesia is a drug which can be given as a shot, spray or ointment. It numbs only a small specific area of the body. It only lasts for a short period of time and is often used for minor outpatient surgeries. Regional anesthesia is a drug that is injected near a cluster of nerves, numbing a larger area of the body. An example of this would be an epidural. General anesthesia knocks out a person completely with no awareness or memory of any surgery. With general anesthesia, the anesthesiologist uses a combination of various medications to do things like relieve anxiety, keep you asleep, and minimize pain during and after surgery. Why is it that the ears look older as you get older, but like the earlobes get longer? And will that still happen with your ears after you have them pinned back later in life?
Yes, this won't really affect the progression of your ears, whatever that's going to be as you age, because we're not actually removing any tissue, we're not removing any cartilage. There are some techniques that remove cartilage, but I'm not really a fan of those because I don't think they leave a very natural result, but it won't affect the progress of the ears.
A viewer wrote in to me and said, Troy, can having ears that stick out affect your hearing?
That's a really interesting question because
I thought it was too.
If you go like this, you can hear better. Theoretically, if you're actually bringing the ear back a little bit more, maybe it doesn't capture the sound quite as well, but there's nothing really documented about that.
I've actually seen people who have had them pinned too far back, and it just offsets their whole face.
Right.
It's quite eerie in a
Yeah,
way.
it needs to be done. You need to be able to see the ears, and that's one of the things I tell patients. Sometimes when they're so used to looking at their ears sticking out, they want it like this. They don't want to be able to see their ears
Yeah.
at all, and I have to try and, you know, educate them that you need to see your ears,
Yeah.
we just need to move them back a little
Okay,
bit.
very quickly. Results immediate?
The results are immediate, yes.
Okay, what's the recovery like?
The recovery is about a week. The stitches stay in
That's
for
it?
about a week, and yeah, you're
Oh.
good to go.
Okay, are they big scars or is it just a couple of stitches?
They're fine line scars that are just really well hidden behind the ears, and they just aren't an issue. You don't see them.
If you haven't had them pinned back enough in the first procedure and a year later you say, Dr. Thompson, I really want them back more, possible?
Very easy to do, yes.
Ah, I love that. Thank you. After the break, we'll get to hear more about the ear pinning from Dr. Thompson, and then we're going to watch as our patient, an 11-year-old boy, actually gets his ears pinned back. It's giveaway time on The Younger You. Enter for a chance to win a BlendTech Express blender and the new Blend Fresh product pack valued at $850. Be sure to head over to theyoungeryou.tv/contest to enter. The following footage contains actual surgical procedures. It may be too graphic for some viewers. We all know kids can be cruel, which is why cosmetic surgery isn't just done on adults. Let's hear from Dr. Thompson about how ear pinning works and then watch him perform the procedure on an actual patient. Dr. Thompson, one of our patients today is Angel. He's 11 years old.
Right.
Talk us through why he felt he needed to have that done.
A lot of times kids aren't always the nicest to each other, and if you have something about your face or about your body that's different, then sometimes people will point that out. And so I have kids coming in saying, you know, even boys saying they want to grow their hair long because they are, you know, they don't want to be teased about their ears, and that happens with girls all the time too. And so usually for most kids, they're the ones that are driving this and want to have it done.
How do you know that it's the right thing to do for that kid right then and there?
When I sit down with a new patient, if the parent is the one that's doing all the talking, then I'm not so sure that the child is ready to do it or that they want to do it. And so the consultation is really important, and that's where I kind of can assess whether this is a good candidate for this surgery or not.
Okay, now we talked about age. Do girls have more of an issue with the ears sticking out, or boys, or it's basically, it just happens?
There's no genetic basis for it. There's no environmental basis. Sometimes people think that it was something that they did, but it's just the way that the genetics are.
It
and
is
it
what
happens.
it is.
And a lot of times it runs in families, but it's not more common in boys or girls.
Okay, so this was truly, it is a hereditary thing.
Right.
It could be.
Right. You ready for this?
Yeah.
Are you excited? Good.
I'm Angel, and I'm 11 years old.
What are we going to do today?
Pin my ears back.
Okay.
They get in the way. They're right here. Sometimes I want it back.
He's feeling good for himself, but I'm so excited if they feel better.
We'll have a little cut on the back side here. It'll go close to the bottom, but it'll be right in here where this fold is, and it'll heal. It'll be tough to see it all. And I'll make a fold in the ear like this, and then I'll pull the whole thing back a little bit.
He has decided to do it. All the time he had the long hair, and then the kids maybe laughing to him because it's open a little bit and the hair is like this. But I was excited. He wanted to do it.
You don't seem worried. You seem excited. I am too. Do you have any questions?
No.
Okay.
You're gonna be bandage face.
No, not too bad. But it's too bad you didn't do this right before Halloween, because then, you know, you could have had a pretty cool costume. See you in a minute.
Maybe he not had too much bullying because he all the time had long hair. That's why they not show the ears. So maybe that's why they not bullying too much.
So I can finally get short hair.
Well, I'm Dr. Riesenberg. I'm your anesthesiologist today, okay? So my job's to make sure you have a nice nap all through it, and when you wake up, you'll be nice and comfortable and warm, okay? All right, buddy. I know. I'm gonna hook that to a long cord, and you know what that does? Squeezes really hard, and it lets me know your blood pressure. Have you given Mom a kiss yet?
Nope.
Oh.
I can't breathe.
All right, bud.
We just watched Dr. Thompson prepare Angel for his procedure. Now let's head over to the surgery to watch the actual ear pinning procedure.
So I'm going to tape his hair up out of the way, and that'll just help the exposure to his ears that we need. I've noticed a lot of times with boys, if they have prominent ears, they wear their hair long because they want to hide their ears. Okay, so what I'm going to do first is do some measurements of his ears, and then that'll give us a reference point for later. Okay, the right side superior is 17, middle is 27, and inferior is 18. So the reason his ears stick out is because he does not have what's called an anti-helical fold, which is this fold right here. So if I let his ear go, it just comes right out, and I need to create that fold for him. And so I'm going to put some permanent sutures in to accomplish that. And my incision is going to be kind of right where these sutures will be placed. The advantage of that is once we have that fold, it'll be like back like this, and you won't be able to see that incision at all. It'll be completely hidden. All right, let's do the local now. This will reduce bleeding, and it'll make it so that he doesn't need as much medication to keep him asleep because he won't be feeling anything.
Coming up after the break, we're going to continue to watch as Dr. Thompson performs this ear pinning procedure. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Check out the Younger You website to watch full episodes of the show, read about our product of the week, and get useful tips and tricks to help you achieve the Younger You. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Everyone is self-conscious about something. That I know about. What was our patient's reasons for wanting his ears pinned back? Let's find out more as Dr. Thompson finishes the actual surgery.
This incision just tends to really be very minimally visible when it heals up, so I like to do it this way. Now I'm going to just expose the cartilage on the back side of the ear, and I'll also expose those stitches that I placed so I can see exactly where I want to place them on the back. So I'm exposing this back side too so that I can actually pull the ear a little closer to the head. So I'll put a series of permanent stitches in the cartilage here to create that fold on the front. So now you can see that all of a sudden it looks like a normal ear because it has this fold. If you look at Monica's beautiful ear here, you can see she has that fold, and now he does too. I'm actually stitching the ear back against his head just a little bit with this stitch because now that I've created that fold, I also want to set the ear back just slightly. Now that looks good. It, I think, is in a good position. It looks really natural. So yeah, this ear now just looks kind of pretty much like a normal ear. This one still doesn't have a fold or anything, and so we need to set it back. But I think this position I'm pretty happy with where it is right now. I tell everybody that our ears are already not the same. If we measured all of ours, they would be different. One side's usually out a little bit more than another one, and so I think if you have that expectation going in, even though when we're done, I'll measure these and they'll all be within 1 millimeter of each other. Sometimes they relax a little bit differently, or they heal a little bit differently, come on out. And so you can have a little difference in the final appearance or position of the ears. Now I'm going to measure both sides and see how close we are. But to me, they look very symmetrical. Post-op measurements are superior 12. Middle is 12. And inferior is 11. Let me just look at those and just see if they're, how close they are. 12, 12, 11, 12, 13, 11. So yeah, everything is within a millimeter. And do you like how they look, Monica?
I think they look wonderful. He's going to be very pleased.
Okay, let's close. This part's hard because now we've pulled the ear back and I can't get back there to sew it up. So these stitches will come out at 5 to 7 days. And like I said, it should just heal up really well. So we're all done. We closed up both sides with a nylon stitch, which is a removable stitch. And now we'll get him all wrapped up. He'll be good to go. So this will just give us a little bit of compression and just protect the ears for the next 24 hours. This will keep it up out of his eyes and still keep a little bit of compression. And these have to be cut just right without cutting any hair. All right. We're all done.
I think having large ears really affects someone's self-esteem.
It can affect people's confidence. It really depends on the person.
We always base things off of other people, so if other people don't look the same, then you might not feel as confident.
Sometimes I think they could be ridiculed for it.
I'm not sure if that would cause someone to bully them. I wouldn't bully someone because their ears are big.
I had a friend in high school who got her ears pinned back.
If you're doing it to make you more confident, do it.
She always had to wear her hair down to hide her ears. She was very self-conscious, never would wear it up. All of a sudden, she's wearing ponytails.
It shouldn't be for anybody else to decide if they can or can't. Because if that's something that'll make them feel better as a person, then I say, go for it.
I think when they get into school and they're getting teased, maybe that's time to look at it.
I just feel like there should at least be parental consent. Are your parents cool with this?
If I felt that that would inhibit my child's success, then yes, I would pin them back.
It'd probably be best if they waited until they matured a little bit, because you never know if it'll stay like that or if it'll kind of transform into a more natural thing as they grow up.
If it's a minor thing, I would let them get to the age that they can make that decision about pinning it back and leave it up to them.
When we come back, we'll be with Dr. Thompson and his patient to talk about the results of this procedure. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. It's giveaway time on the Younger You. Enter for a chance to win a BlendTech Express blender and the new Blend Fresh product pack valued at $850. Be sure to head over to theyoungeryou.tv/contest to enter. After being teased by his friends about his ears, will our patient be happier now that he's got them pinned back? Let's head into the studio to see if he has a newfound confidence. Dr. Thompson and I have been joined by Angel and Lexi. Welcome to the show, guys. Now, these were our two patients that had the procedures done.
Right.
Okay, how old are you?
11.
11.
14.
Okay, before we look at your before shots, why did you want to have this done?
If I cut my hair, I would probably be bullied a lot.
Okay, so you always had long hair?
Yeah.
Okay. Did anyone tease you at school?
No, because I had long hair and I always covered them.
And you never wanted it cut short?
Mm-mm.
But we were talking a little bit earlier on about being bullied. Do you truly think that if you did cut your hair, you would have thought people would have made jokes at you, or?
Some people.
Okay, okay. What about you, Lexi?
Well, I dance a lot, and so in dance you have to pull your hair back, and I always felt really self-conscious about my ears. And even when I was running late for school, I'd never pulled back my hair.
Dr. Thompson, let's look at Angel's before shots. Did they stick out that much? Did you think that they were that bad?
Well, this is all a combination of what the patient sees and what I see. The most common problem with ears that stick out is that this fold right here is not there, and so it makes the ear go like this. It's not so much that the ear is out, but the fold isn't there, and so if we recreate that fold, all of a sudden the ear sits where it's supposed to be.
Okay, let's have a look at Lexi's before shots as well. What do you see when you see that, Lexi, your before shots? You know, there's pictures of you with, you know, your hair up. How are you feeling about that?
It's embarrassing, really.
Okay.
I just always felt really self-conscious about my ears.
All right. Dr. Thompson, explain a little bit about her procedure that you were talking about.
With Lexi, we were able to do the procedure under local anesthesia,
Okay.
and she's one that didn't have this fold that we were talking about. And they're cute ears, and they look cute on her, but they just are out a little bit too far, and they draw attention to themselves.
Yeah.
And so we want the ears to harmonize with the rest of the face. And so just under local anesthesia, got her numbed up in the office, made a little incision, and put some stitches in to create this fold that she has now, and I can show it on this side. This fold right here was absent before, and now she has it, and so that's why the ear is back.
Okay. Do you feel, Lexi, that this has given you the confidence boost that you thought you needed?
Absolutely. And having this done, I can go out and I can have up my hair like other people, and just it makes me more confident.
Dr. Thompson, you know, people will sit at home and they'll be saying, why did we do this operation on 2 kids?
Right.
You know?
This is important because they're a distraction for both of these kids. They have, yes, their normal ears, they can hear out of these ears, but their life is altered by them. And so if we can make them something that they don't have to worry about or think about, then they have confidence to cut their hair short, and they don't think about their ears anymore as kind of a negative factor of their face. Those are small things, but you take care of that small thing and it really is a confidence
See,
booster.
I don't look at it as a vanity problem. I truly do think it's confidence. Do you think you would have done this later on in life if this wasn't possible on the show?
I think that I would have,
Okay.
yeah.
I've had a couple of adults, even elderly patients, come in and have this surgery done, and they told me, I have been bothered by my ears and teased about my ears my entire life, and now I can finally do this, and I'm doing it.
What did your mum think about when you said you wanted to have this done?
She was like, I'll stick with you if you want to do it, but if you don't, just let me know.
Your choice.
Yeah.
And I think that's the important thing here, Dr. Thompson. It really is you here to see if the kids want to have it done.
It's their ears, it's them going through the procedure, and both of their parents were extremely supportive. Neither one was pushing in any particular direction, and it really is the decision for the
Lexi,
kids.
did you get teased?
I did a little bit.
What would be things being said to you?
A lot of people would say that I looked like an elf.
Okay.
That was the biggest comment I got.
How did it feel for the first time to have your hair cut short?
Felt good.
Did it?
Yeah.
What do you think of Dr. Thompson?
I don't know.
You don't know? I've got a card here that you did, and it's a picture of you with big ears and another one of you, and long hair, now with small ears and spiky hair. Why did you do that?
To just give him a thank you letter for putting my ears back.
I so appreciated that card. That's one of the reasons that I'm happy that I do what I do, because of these kind of patients. They're just fantastic.
Well, they're good kids. I'm not allowed to call you a kid. Sorry, Lexi.
No,
I'll be in trouble. Thanks, guys. I really appreciate it. If protruding ears is something that is either a problem for you or for your child, you might want to consider having otoplasty surgery. Being a younger you is about more than a cosmetic surgery. It's also about confidence, no matter what age. For more information about this show, please head over to our website at theyoungeryou.tv, and I'll see you next week. Coming up next week on The Younger You, we will watch as 2 patients get a brand new smile. The Younger You set provided by Madison McCord Interiors.